The mechanistic explanation for the co-occurrence of ADHD and bipolar is believed to, in fact, involve several different levels of convergence. First, at the circuit level, the circuits that subserve disparate domains of cognitive function, executive function, for example, those circuitries that are implicated in that phenomenology are identified as abnormal in structure, function, and chemical composition in both bipolar and ADHD. If we cascade down and we look at within the circuits, the cellular populations, or the nodal regions that are implicated in bipolar ADHD, they're similar. So regions like prefrontal cortex, regions like hippocampus, reward circuitry like the striatum and the nucleus accumbens, ventral tegmental area. So we have convergence of circuits, we have convergence of nodes, we have convergence of networks. Then when we go even further down, cascade further down into the neurochemistry, what we actually see is a convergence of similar neurochemicals that are implicated in both conditions.
Right.
Let's keep going further down. Then you look within the cell at the intracellular signaling cascades that are implicated in cellular integrity, morphology, and function. They're similar. And now we've got genetic literature showing that the genetic architecture of bipolar and ADHD significantly overlap. So we take a multi-systems approach, the circuits, the nodes, the networks, the cells, the intracellular, the genetics. You've got tremendous convergence of potential factors that could explain why they co-occur.
Okay.
And what is also important to keep in mind is that both bipolar and ADHD are neurodevelopmental conditions. And I talked about homotypic continuity versus heterotypic continuity.
That's a good point, yeah.
And so what happens is that for many people, they're starting off in the same place, and based on environmental influence, they start off as ADHD, and then they sort of stay ADHD for the rest of their life. Others start off as ADHD, and they kind of morph into bipolar disorder.
Right.
Perhaps because of some altered genetics at the get-go, but also because of some environmental influences and epigenetic changes. So we have both types of trajectories, both types of continuities, homotypic and heterotypic.
Perfect. And can you speak to about how the expression of somebody's symptoms that have bipolar and ADHD might be uniquely different to other people?
The big difference between people with ADHD and bipolar versus bipolar alone really rests in the complexity of the cross-sectional presentation. People are more likely to have depression, more likely to have mania, more likely to have suicide thinking, and more likely to have cognition. We also found in my study they're more likely to have binge eating and maybe other comorbidities. So like, for example, they're more likely to have drug and alcohol misuse, more likely to have binge eating, more likely to have impulse control, which all in fact can be distilled down into the substrate of impulse control. When you look at the course and the outcome of the illness, it tends to be much more severe. Earlier age at onset in the combo group, much more non-recovery, much more chronicity, much more recurrence, much more service utilization, much more cost, and so on and so on. So they have a very different phenotypic trajectory.
Can I ask you more questions?
Sure,
Is that okay?
yeah.
So you spoke about like ADHD as sort of a term that encompasses, if this is correct, just cognitive dysfunction in general when it relates to bipolar disorder. And do you think it's problematic to just do research saying that it's a comorbidity versus just as a part of a dysfunction?
What a great question.
Bipolar disorder.
It is my view that to delimit the research to ADHD and bipolar as two standalone organisms is a waste of time.
Right.
Because there's no zone of delimitation.
Right.
There's no sunshine between the two diagnoses. So I think, in fact, you should just study, and I just briefly spoke to this, domains. Just look at domains.
So in the RDoC sort of system?
Yes.
Okay.
Now, whether it's specifically RDoC,
just-
I'm not invested in that.
Right.
But I do think we should be studying domains and look at the domains, because I think someone comes in, this gentleman I think spoke to at the microphone.
Right.
Person comes in, they've got affect dysregulation or emotional dysregulation, and they got cognitive problems. All I really care, if you have cognitive problems, just treat it.
Right.
That's all I think.
Okay, and you spoke about sort of things like obesity and cannabis being
Sure. Huge.
large portions of why a lot of the cognitive dysfunction exists in the first place.
Huge.
Can you speak to, especially cannabis, because in the Reddit community, cannabis is a very big component of
What people talk
culture.
about. Yeah. So there are many modifiable factors. There's no question that depends on the cannabis we're talking about. If it's delta-9 THC,
Right.
it's bad news. It's bad news for cognition. Now, CBD, cannabidiol, may in fact be beneficial. I don't know. But right now, the evidence that CBD is helpful is looking kind of interesting in some domains of
That's
psychopathology.
interesting because that was also the fifth most popular question. Was
Okay.
related to dietary factors of bipolar disorder in
Okay.
general. And so they asked about whether CBD would be helpful, not specifically in the ADHD bipolar domain, but just in bipolar itself.
Right
Can you
now,
speak to that,
we
sir?
could not say that CBD is helpful,
Right.
period.
But is
Because
there
no one said-
avenues of research that are
But there
looking into
is,
it?
I think, a very viable, testable hypothesis that CBD could help some bipolar patients because it's anti-pain, it's anti-inflammatory, it's antipsychotic, it's antidepressant, it's anxiolytic, and helps sleep.
Right.
It may be pro-cognitive, we don't know that, but it doesn't seem to be harmful. And so, as a matter of fact, I think CBD, we're going to do a study with CBD at my center.
Right. That's
So,
awesome. Where
yeah,
is it?
we're going to look at cognition. I'm in Toronto. We're going to look at cognition outcomes in people taking CBD. We're going to start the study.
If you need participants, like
Yeah. But you got to correct the thyroid. You got to lose the weight.
Right. Yeah.
You got to get a normal night of sleep. You got to get you got to get rid of the alcohol.
And so the data with obesity, is it more correlational or is it?
No,
is it showing...
it's causative because
Okay.
obesity causes a change in inflammatory and insulin change in the brain, and we've got lots of evidence on that now.
Perfect. Okay. All right. If I think of some more questions
Reach
that other
out.
people ask, can I email
Reach
you?
out, Tom.
Okay.
You
Perfect.
bet. Reach
Thank
out,
you.
Tom.